Good evening. Just wanted to do another installment here on our Elevation podcast. Tonight, I'd like to talk with you specifically about functional medicine and how that differs from traditional allopathic medicine, and also your relationship with patients compared to maybe your background. So, if at first, could you just give us a quick background on your history and your experience?
Absolutely. Good to talk to you as always, Charles. So yeah, you know, finished high school, went to school to be a teacher, taught history and government for a couple years, decided I wanted to make a change still while I was really young and got into nursing. And at that point, started working in the ICU and surgical ICU. Liked the challenge of it, the adrenaline of it, but at a certain point, um, that wears on you. So I made a move to the operating room because I was really interested in surgery, worked in the surgical recovery side, and then made a move to working in the operative part of it. And did that for a long time. I loved it. I loved the operating room. Got to the point where I was doing so much that everyone said, you should get paid for what you're doing. You're working as a nurse practitioner, but you're getting paid as a nurse. So I went back to school, got my nurse practitioner degree, and started working in cardiac surgery at the Cleveland Clinic. Seeing patients pre-op, post-op, operating on them, from start to finish. And it was, again, great adrenaline rush, saving people's lives daily, complicated, and again, loved it. But you're a stopgap. What you're doing is you're saving their life, you're passing them on, and you're just saying, hopefully they get better, hopefully they recover. But after a couple weeks after surgery, they're someone else's problem. So when I moved to Charleston and met Dr. Salibi, I really wanted to get into something where I can find the root cause, fix the people, see them progress, see them heal, and then keep them better. The whole process, start to finish, instead of kind of being the middleman, fixing the acute problem. So that's when I got into functional medicine. So that's kind of my Cliff Notes version of how I got here.
Understood. So, functional medicine, you get to touch the patient more cradle to grave, no pun intended. But
Yeah,
just the holistic kind of arc of their care instead of just one specific time period. You get to work with them for a long period with a holistic plan. So that kind of answers why you chose functional medicine. How long have you done functional medicine now?
yeah. So I've been at Carolina Holistic Medicine for 3 years now. So been in functional medicine for 3 years, and what I really liked about it, what drew me to it, was I kind of have one foot into the western side. I have one foot in the eastern side. So you have your naturopaths, your completely holistic people, and then you have your Western medicine people, these complete Western side. I like to think of myself as someone who can take the best of both worlds and kind of blend them to optimize the patient. So
Mhm.
whether it's they might need a prescription, they might need an aggressive treatment plan. I'm willing to do that. They may need a more holistic and natural plan of care. It's really dependent on how sick they are. It's really dependent on the patient's want and needs to stay in the eastern side or western side. But I give options, and that's, I think, the best part of functional medicine is you don't walk out of the doctor's office saying, this is my problem, this is the medication I have to take. You walk out saying, these are my problems, these are my options, and I choose what I thought was best for me in this moment. I can always change, but I give patients options.
Good deal. So why should a patient then, I think you've sort of already answered this a little bit. Why should a patient choose functional medicine for for standard health and chronic issues in their body?
Yeah, I always tell people if I have a heart attack and I need surgery, I'm not going to go see a functional medicine specialist to operate on my heart, right? I'm going to go
Right.
see a cardiac surgeon. If I need someone to fix my broken leg, I'm going to go see an orthopedic surgeon. But if I want someone to take a look at me as a whole and make sure I'm the healthiest person I can be, handle any chronic illness, handle any deficiencies I have in my body, I'm always going to go to the functional side because a good example is, you know, 2 or 3 patients I saw today. You know, they come in, I had, 4 new patients today. So they come in and I hear the same story. It's like I came in, I had 8 to 10 minutes with the provider. They looked at my labs real quick. They're like, "Oh, your thyroid doesn't look great. Your A1C doesn't look great. Maybe you have some prediabetes. These are the 2 medications we're going to put you on." And they're out the door. They don't know why. They don't know what their medications are for, the dosages, the side effects, the long-term effects. So the reason I think people should choose functional medicine and why a lot of people do is we're going to sit with you for an hour, maybe even a little more. We're going to discuss why your body's doing what it's doing. We're going to figure out a best case scenario for where we can get you, and we're going to discuss all your options, and we're going to try to make your body work for you. We're not going to try to suppress symptoms. We're not going to try to cover up the problems you're having. We're going to fix the root cause so that way you can thrive long term, anti-age, feel your best, have energy, be able to be your best self later in life. So that's my kind of pitch to people as far as what functional medicine can do for you.
So you mentioned the visit, and what stands out to me among the other things that you said was you actually spent an hour with a patient.
Yeah, at least. Yeah.
Yeah, because I've been to doctors, DOs, MDs, whatnot. Chris, they barely step in the room. One
Hmm.
foot's literally still in the hallway, and before I'm even done talking to them, they're reaching in their pocket, getting out their script book, and I'm gonna get a couple pills, like you said, I don't even understand, and they're gone. I mean, I
Yeah.
feel like I'm talking to an attorney with billable hours sometimes.
Yeah.
And
I was that guy. I was that guy for a while. We did our post-op visits in cardiac surgery, and um, my goal, and this sounds terrible, but my goal was to not have to sit down. If I sat down, I'm running behind, right?
yeah,
Because now my next patient's going to be late. My next one's going to be late. I'm going to be running late in the day. I got to still go back to the hospital and see my post-ops. So it's like if I can get in the room, go through the labs, check the patient, and answer as little amount of questions as possible, I can stay on my 8 minute per patient plan that they give me. So yeah, I get it's not the provider's fault; it's the system's fault. The system sets you up as a provider to fail because they don't give you time to actually spend time with your patients to get to know them. I'll spend at least an hour with a lot of my patients. We book them for an hour to an hour and 15 minutes. Um, some of that time is just talking, which I think is just as important as the treatment part of it because I'm getting to know them, their family, their spouses. I'm getting to know their history, what they like, what they don't like. And that all helps to develop a plan to get an idea of kind of what their goals in life are. And when we leave the appointment, not only are they confident with the plan, optimistic that they're going to get better, but they give me a hug. They ask me how my family's doing. They have a great holiday. Like it's a personal relationship. And the downside, not that it's a downside, but the complicated side is it consumes a lot of my life because I truly care about these people. And on weekends, on holidays, off shift, I'm looking through emails. I'm like, oh, how's this person doing? How's this person doing? I'm sending them emails to check up on them, which I didn't do when I was in cardiac surgery. I didn't, not that I didn't care, but it was just kind of like you fix the problem. They weren't really on your mind when you were home. My
mhm.
patients are on my mind all the time, and I really truly want them to get better because I have a really good relationship with them, and I feel like they're friends. They're people I care about.
Mhm. So that's how an allopathic appointment versus a functional appointment would run. Everything you just
Yeah,
told me.
yeah,
So tell me about goals you give. Okay, I see what you do in the appointments, but tell me about goals you give your patients when they leave.
sure.
I'm sure they've got like a homework list. Tell me about that.
Yeah, the good thing is most of the patients come to us because they truly want to be better and they really truly care about their health. Um, can't always be said about all patients, but in Western medicine, sometimes it's like the patients show up, you tell them to do something, they go home, they come back, and they're like, "Nah, I didn't do it," and I still eating bad, I'm still not exercising, and it's like it's frustrating, but it's their choice.
Hmm.
Most patients coming to us, because we don't accept insurance, because there's a fee involved, it's kind of putting them in a position where it's like, if I don't listen and do what I'm supposed to, I'm kind of wasting my money. So I do need to be active participant in my health. So a lot of times the big things I send patients home with is, one, stick to my plan. Read the plan, stick to it. Take the supplements, take the medications, do the things I'm asking you to do, because that's going to give you the best chance of success.
Hmm.
Diet is always a big one. Give the patient a generalized diet plan of what you should eat, what you shouldn't eat, what you should not, avoid. That's a big one that patients need to do. Exercise. I kind of, based on the patient's health and their ability, I usually give them an exercise goal, whether it's once a week to get outside and walk for 10 minutes to, 5 to 6 times a week, you need to be doing 30 minutes of exercise a day. That's on the patient to do that part. And then the tricky one is control lifestyle, right? Stress, try to control stress the best you can. Try to make sure you're getting sleep. Try to make sure that you are doing all the things to put yourself in a position to be successful. Put yourself first. Be selfish with your health. A lot of women come to us and they're the caregivers in the family, and they're trying to take care of everybody else, and they put themselves last. And I have to kind of stress to them and their husbands, if their husbands are with them, let her be first, let her take care of herself for a little while and then come back to you guys. But if they don't do that, she's never going to be your best, and everyone's going to suffer, because when mom's not feeling good or the wife's not feeling good, the whole household tends to suffer a little bit from that. They're kind of the glue. So that's kind of the stuff I usually send them home with to try to do on their own, as I work to kind of fix the blood work, fix the symptoms, fix the inflammation.
Right. I like that. I mean, as I've gotten older, I've discovered that myself, that if I don't take care of myself, be a little selfish, I've got nothing left to give to anyone else. So you just
Yeah.
bring yourself out. So great advice.
Yeah.
Let's switch gears a little bit. Recently, you got an award and you were recognized in Who's Who of America. Tell me about that.
Yeah, it was something I was really excited about. I got nominated by a couple of patients for the it was originally a vote for best functional provider in South Carolina, and I got some patients who had nominated me. Our practice ended up getting one of the top functional medicine specialties and clinics in the Charleston area. And Who's Who of America saw this and saw that I had been nominated by a few patients, and gave me a call and said, we're going to consider you for Who's Who of America for your work in functional medicine. There's a little over 1 million people since it's like 1980 something that have been included in this. So somewhat exclusive. You
Mhm.
figure over 100 and some years, about 1 million people. So I did a couple interviews with them, and they contacted some of my patients. They looked over things I did, and they decided to include me in the Who's Who of America for 2025, 2026. And not only is it a good honor for me to be recognized for the work I'm doing and the work our clinic is doing, but it's just an opportunity to get our name out there even more, for more people to know we exist, for more people to understand what we do, and hopefully we can reach more people, because that's really the goal in functional medicine, is to try to reach as many people as you can and help as many people as you can.
Well, congratulations on that. It's a real honor. I think
Thank
what's
you.
really telling about it is you were actually nominated by your patients. I've had a couple really good doctors in my life, but they're more the exception than the rule. Not to denigrate anyone, but I mean, for them to really stand out enough that a patient would go to that length to make sure you're recognized, I think says a lot. Let's talk real quick about health education for patients and their success on their health journey. How important is it? Because you kind of alluded earlier that you can do what you can do in the office, but the patient has responsibilities as well for their health.
Yeah.
What about education and educating themselves? How important is that?
Yeah, I try to give them the tools. When you talk to any of my patients, they'll tell you I like to draw figures and diagrams, and I'm a teacher at heart. That's what my first job was, as a teacher.
Right.
So I like to draw things out for them. I like to explain it because my feeling is if you understand what you're doing and why you're doing it, and you understand your health issues and the treatment plan, you're going to be much more compliant with the treatment plan. If you
Right.
don't know why you're doing it or what you're doing it for, it's very easy to be like, I don't even know what I'm doing or why I'm doing it. I'm just going to stop because I don't feel any different. But
Yeah.
if you know what you're doing and there's a reason behind it, and I tell them, we're treating your thyroid, and this is your thyroid hormones, and this is how your thyroid is converting, and this is why you're feeling sluggish, and this is the reason why this medication or this supplement is going to work to help you feel better. They know, even if I don't feel immediate results, I know it's working to make me healthier in the end. So they stick to it. So I give them all the tools to understand. I don't like Dr. Google, like everyone calls it, where patients just go home and just Google hypothyroid and then come in with like, well, I heard this and I was, you know. So what I try to do is give them the groundwork, give them the basics, and then if they want more information, I point them in the direction of good material, good books, good literature, good studies, and give them the right information for them to study at home. If they don't want to, if they're like, hey, you got this, I understand what you're trying to do, but I'm leaving on you, then that's fine too. So some patients want to know everything. Some patients want to know the bare minimum. I try to give them as much info as I can so that way they can feel comfortable as to they leave the office and they're like, Chris knows why he's doing what he's doing. I understand for the most part why he's doing it. And I know if I follow the directions, I'm going to be healthier in the end. So it's it can be as much or as little as they need based on what they want. But everyone gets education. That's why the visits take an hour. 30 minutes of it is just me teaching and
Yeah.
probably talking more than I should.
Gotcha. Gotcha. Well, that sounds tremendous. I mean, if they come to Carolina Holistic Medicine, they're going to get an hour of your time, and that's really for all of our providers. Um,
Yeah.
and then, I think I calculated once if I put all of your experience together, we have well over 100 years of medical experience in the practice. And tell me just real quick, I mean, how often, because I know you're very experienced, but if there's a case or how often do you confer with each other as providers to kind of put your heads together for treatment?
Yeah, it's interesting. We have, like a quote unquote like group chat between all of us.
Mhm.
And every single day there's a good handful of questions coming from providers that Dr. Sleevy and I are trying to give our input, tackle these problems, kind of point the providers in the direction of which way we would go and what to
Mhm.
look for and how to treat. So it's ongoing.
Yeah.
It's not just in 9 to 5, like there'll be a text coming through at 8:30 at night because somebody jumped on the computer and they're researching their patient for the next day and they're like, hey, this doesn't seem right. What should I do for this patient tomorrow? So like I said, the dedication with our providers and Dr. Salibi is, in my opinion, unmatched in that we are really working around the clock in many cases, always thinking about our patients, always trying to figure out how to make them better. And that shows in the success of our patients, that shows in how well our clinic is viewed, and it shows in the people we surround ourselves with. Very
Mhm.
successful, um, very goal oriented people that have patients who really like us, that really love us. And you look at our reviews on Google, you look at our reviews on other websites. The patients don't just say, "Hey, Chris was great. Went over my labs with me." They're like,
Yeah.
he listens, he does everything he can to make sure I'm happy. Takes my life seriously and listen. They really appreciate what we're able to do for them.
This is phenomenal. Let me just do a little plug here. If potential patients want to see you, Dr. Salibi, any of our providers, they can go to our website, just click on request an appointment, and an inquiry form will pop up. They can fill that out, and our onboarding coordinator will contact them and start that process with them. Also, again, you mentioned we don't take insurance. However, we do have membership plans at all different levels that are very affordable. And depending on what level of care you need, we can discuss with you which membership plans would be appropriate. But thank you, Chris, for your time tonight. Do you have any final thoughts before we go, or have you
Yeah, I mean,
exhausted everything?
the main thing is, you know, look at your options when it comes to your health. Don't just take the traditional route of I'm just going to go I'm going to find a PCP, I'm going to go see them, I'm going to take them at their word, I'm going to see the specialist they tell me to, and just kind of follow blindly. Take your health into your own hands, put yourself first, find the people who you think are going to give you the best shot at making yourself as healthy and as optimized as you possibly can, and follow what your body and your heart are telling you to do. Never just take the status quo as that's what it is. So if I can always reach out and tell people, it's if you love your PCP in Western medicine, you think they have your best interest in mind, I mean, stay with them. That's great. Like, build a relationship. But if you feel like you're just a number on the board and you're not really getting that specific care that you really want, try to find options, try to see what else is out there, and find something that fits what fits you the best, not just what fits the system.
Fantastic. Fantastic. Again, Chris, thank you for your time tonight. And hopefully this will reach some people that need to hear it. And again, always welcome to contact our practice, especially if you want to see any of our providers. So again,
Absolutely.
Chris,
Always
thank
a
you.
pleasure, Charles.
All right, thank you. You have
All
a
right.
great
Talk
night.
soon, man.
Yep.
You too. Bye.